So to pick up from where we left off in class, again, we're talking about teratogens. Teratogens are any outside environmental influence that can affect the development of a developing organism. So this can be anything including disease, alcohol, drugs, illegal and over-the-counter medications, prescriptions. It can include really even herbal supplements, radiation, really anything that's outside that is then affecting the development of the organism. And teratogens aren't just something that humans have to deal with, they're something that all species have to deal with. And in fact, a lot of the research that we have on teratogens does come from other species studies. It's important to remember that each teratogen affects a specific aspect of prenatal development. So where one teratogen may do one thing, another teratogen may do another. Again, we do not have this one-to-one relationship with teratogens. We do not see the same thing happening regardless of where it is in development. We can see different effects of the same teratogen at different points of development. And we can see different teratogens having different effects. So, for example, rubella affects eyes, ears, heart, but not limbs. So it's again affecting the development of certain systems, but not others. PCBs affect they have normal physical development. So physically, the organism looks fine, but we have below average memory and below average verbal capabilities as well. And so these, because you don't see them until later at life, not at birth, these can be harder kind of teratogens to necessarily pin down. We have learned that we do have this, that PCBs do have this effect. But again, these are not things because at birth, we have 10 fingers, we have 10 toes. Size seems typical. It's not until we really get older that we can really see the effects of these. And we'll see that with other teratogens as well. So kind of the most famous of all teratogens is thalidomide. And it was highly prescribed in the 1960s for various different kinds of things. And what we saw was major defects in the legs and arms of the children that were exposed to it. And we saw less frequently issues with ears, heart, kidneys, and genitals, and even some cognitive impairments. But here are some pictures of those kids. If you can see here, all of these kids appear to have normal leg development, but are somehow stunted in some way in arm development. So we see a lot of kind of arms that didn't fully extend, no hands, those sorts of things. In this picture, we see a child where we have kind of a toe in a place that you don't normally have a toe. So again, that's a pretty severe kind of abnormality. And if you search thalidomide, there are some really, really terrible pictures available online. And they thought thalidomide was safe because it was safe for other animals. We didn't see these same kinds of issues with other organisms. And so it was widely prescribed. And then we had a huge number of children that were affected by this. DES is another one of the known teratogens that's no longer really used, and we know to keep it away from pregnant women. And what's ironic about this one, that it was actually used to prevent miscarriages. So it was actually used for almost specifically pregnant women. And what they found much, much later is that daughters of women who were prescribed DES in adolescence and adulthood had higher rates of vaginal cancer, had malformations of the uterus, and had issues with infertility. Remember how the female reproductive system develops? It's basically all the eggs you're ever going to have are developed in utero. And so much of the reproductive system for a female is developing in utero, that this DES caused really long-term effects, but you didn't see those until these daughters got into adolescence and adulthood. So again, sometimes these things are really, we're not seeing them till much, much later. Accutane is used to treat severe acne, and first trimester exposure to this can cause abnormalities. Remember, the first trimester is really early on in pregnancy, and so a lot of times people don't know that they're pregnant, especially teenagers. They don't know that they're pregnant, and they may be also being prescribed Accutane. It's my understanding that girls who are prescribed Accutane have to also be prescribed birth control, because there are these abnormalities, there are these known birth defects from it. They include abnormalities in the eyes, the ears, the skull, the brain, the heart, the immune system. So we're talking about some really major abnormalities here. And so again, this can cause some pretty devastating kinds of issues. Aspirin, everybody thinks, oh, aspirin, that's really innocuous, right? Low birth weight, infant death, poor motor development, lower IQ. Caffeine, it has more mixed results. It has some research that links it to low birth weight and miscarriage, and then there's a lot of other research that says no, that's just unfounded. So again, that one's going to be one that a prenatal health care provider is going to have their own opinion on and kind of direct you in one direction or another. Tobacco, we all know smoking is bad for you, and being exposed to smoking is bad for you. This is especially true for the developing organism, because they're getting all of their oxygen and all of their nutrients and everything from the mother. So when this has been exposed to her, there's not really any way to kind of prevent the child from being exposed as well. So we have low birth weight, again, can be one of the consequences of this. And again, remember that not every organism has every one of these effects. Remember, as I said, my mom smoked some, not the whole time, but some while I was pregnant, and I was 10 pounds 3 ounces. Clearly, we didn't have a problem with low birth weight. So again, every teratogen affects somebody else, every organism differently, and you can't predict what that's going to be. And so everybody's heard, well, so-and-so did this while she was pregnant and her kids are fine. And they really may be. There really may be no issue with them. But you can't say that that's going to be applicable to another individual and another pregnancy, and even another pregnancy of that same person. So again, teratogens don't have that one-to-one relationship. Smoking also has a rate of miscarriage, an increased rate of miscarriage. And again, this is also exposure to smoking. So this is not just the mother's use of the teratogen. This can be the father's use or others around her use of this. Premature birth, impaired heart rate and breathing. We can see higher rates of infant death, higher rates of asthma and cancer, which are really make a lot of sense. Those are pretty clear. And then we can see some cognitive impairments as well. Alcohol, we all know, is again a really major teratogen, and it can cause mental retardation, facial anomalies, and we also have a lot more names for those. We have FAS, which is fetal alcohol syndrome. We have FAE. We have PFAS, which is partial fetal alcohol syndrome. There's kind of a spectrum here of alcohol-related birth defects. The features of fetal alcohol syndrome include facial malformations, so you can see that this little child's face doesn't have the same formations. One of the primary ones we see is the distance between the eyes, and the space under the nose is a lot flatter, and we'll see this in another image. These children typically have issues with heart problems. They can have congenital heart disease. There can be issues with failure to thrive, behavioral problems, learning disabilities. Remember how much brain development is going on prenatally, and we know alcohol is bad for the brain. So you mix these two things together, and you can see they can have really devastating consequences. Fetal alcohol syndrome and alcohol as a teratogen is actually the leading cause of mental retardation and birth defects, which is really upsetting because it's 100% preventable. It's not like something like a prescription medication where you had to take that prescription. It's not something that you have, it's not like it's smoking where you necessarily can't control somebody smoking around you. You can control whether you're drinking alcohol or not. And so again, this is kind of an upsetting statistic given that information. The rates are about 0.5% to 3 in 1,000 in most communities. Again, it's 100% preventable. This is something that it really can be eradicated. Fetal alcohol syndrome also includes things like slow physical growth. If you see, here is the image I was talking about. These children, these are issues with facial abnormalities. We tend to have smaller heads. We have smaller eye openings, a flat mid-face. Again, that philtrum underneath the nose is a really flat. If you kind of feel yours usually has a little bit of a ridge in it. Children with fetal alcohol syndrome typically don't have that. They have an underdeveloped jaw, they have a thinner lip, a shorter nose. All of these things kind of work together. To have a diagnosis of fetal alcohol syndrome, you need to have at least 3 of the facial abnormalities. And again, there's many of those. There's usually also brain injury, which is evidenced in at least 3 various areas. So we'll see that through kind of more behavioral testing later in development. So fetal alcohol syndrome is not something that they can diagnose with 100% accuracy at birth, because there needs to be these kinds of impairments as well. Partial fetal alcohol syndrome has less of the symptoms. We only have 2 of the 3 facial abnormalities, but we still have brain injury in at least of those functions. We have ARND, which is really just the cognitive piece of fetal alcohol syndrome. So we don't have the facial abnormalities, but we have neurological deficits in 3 areas, such as motor skills, hand-eye coordination, learning disabilities. All of these, again, are indicating some sort of brain injury. Again, this is 100% preventable, and there's a lot of really good information on nofas.org. So if you're interested in this, you can go there and see all the different things that are being done, that can be done to really kind of eradicate this kind of prenatal developmental exposure. Illegal drugs. Actually, 4% of pregnant women take illegal drugs, according to the U.S. Department of Health and Human Services. That's a lot, if you really think about that percentage. That really does amount to a large portion, a large number of individuals. And these are usually also, again, being used in tandem with other things. So we also have problems with malnutrition. We also have problems with alcohol, cigarettes. All of these things can kind of work together in tandem, which is just going to exacerbate the effects of any one of the teratogens, not to mention all of the teratogens. We see issues with low birth weight, prematurity, physical defects, breathing difficulties, infant death, addiction, and withdrawal. We will see these to varying degrees with different levels depending on the specific drug. And remember, teratogens are dose and timing dependent, and exposure dependent. So how much you get, how often you get it, for how long you get it, all of these things are changing kind of the game for the individual organism. But again, these are individually organism based. So different individuals are going to respond differently based on their genetic makeup. Cocaine, we see defects in the eye, bone defects, genital defects, urinary tract defects, kidney defects, heart and brain. We see brain hemorrhages, which is going to cause, obviously, a lot of further brain damage, seizures, growth retardation, and cognitive impairments. Heroin and methadone have lower attention, slower motor development, and there really are some lifelong deficits for this. A lot of these, again, we'll see a lot of problems at birth, but in really, really supportive environments, these can be overcome. Not all of them, obviously. If you have physical abnormalities, there's not a lot that can be done, but a lot of the cognitive things can be overcome with really supportive environments. But heroin, we see that being a lot harder to overcome. Marijuana is linked to a smaller head size, which we use head size as a measure of brain growth and brain circumference. So it's not that you just have a small head, it's that you typically have a smaller brain then, which obviously can have a lot of negative impairments. We see problems with sleep and attention and memory problems. Again, this is going to be pretty much linked to the brain. There's various environmental pollutants that can be really harmful to kids. Again, I assigned you guys to read this body burden article from the Environmental Working Group's website, because these were normal, typically developing, healthy kids born without defects. And so just like we saw with DES, and we saw the later vaginal problems and infertility and cervical cancers and those sorts of things in those adolescents and adults, we didn't know right away that that was what was causing the problem. So a lot of these things may be causing problems that we're really not aware of. And again, these aren't women that were living in industrial waste dumps. These are just women living in the environment. The Environmental Working Group has a lot of really great information about the chemicals that are in our environment. They do really helpful testing, and they put this out for all the consumers. So they do really, really helpful testing about your cleaning products, which cleaning products have what kinds of things in them, and they rate them kind of A to F on the kind of chemical exposure. And if you're concerned about specific kinds of chemicals or specific kinds of effects, like if you are pregnant and you're concerned about these kind of more developmental things, you can look for things that don't have those kinds of issues in them. They also have things for sunscreen, which ones are helpful, which ones are not, cosmetic products, makeup, shampoos, all of that. There's really helpful information about organic fruits and vegetables, which ones you really should buy organic because the traditional ones have a lot of pesticides still present, versus which ones doesn't matter if you buy them organic or traditionally because the pesticide counts are so low. So there really is just a lot of really helpful information on that website for those who are interested in kind of their exposure to these kind of environmental toxins. So again, this is required reading. Read it. There is a test question on it, so read it. Again, it's really, really important to remember that the impact of the teratogen depends on the individual organism. So this is not something that if I give the same dose to 6 different people, I can expect the same, or 6 different rats, I can expect the same outcome in all 6 rats. And I can't even expect the same outcome, and I definitely wouldn't expect the same outcome in rats versus rabbits. So again, it really depends on the individual constitution of each organism. Because of this, parents should really discuss all drugs, medications, vitamins, herbal supplements, and any questions or concerns with their prenatal care provider. So they're going to have a lot of information on any of these kinds of things and whether they are things to be concerned about or not. Again, this teratogen lecture usually freaks people out, and this is not meant to freak people out. It's more about education and awareness than it is about freaking people out. I knew all of this. I taught all this stuff when I was pregnant, and I in no way kept myself in a den of solitude. You just have to be aware of the kinds of things you're being exposed to really be protective. But it's nothing that you need to be scared about or be worried about in really dramatic ways. If in doubt, my advice would be to err on the side of caution. It's always easier to go without something than it is to possibly cause an issue. So again, I would discuss everything with the prenatal care advisor, but if there still is concern or there still is doubt, erring on the side of caution can be very, very helpful. Malnutrition is a big issue in prenatal development as well, and malnutrition really can be considered to have teratogenic effects as well. Consequences of malnutrition, again, we talked about folic acid already. Remember, folic acid is really important for those neural tube, proper development of the neural tube when we have the folding over and the fusing. If we don't get properly fused, the neural tube isn't closed, and we see spina bifida. So that's where we can have exposure of parts of the brainstem, brain, all kinds of different levels, which can cause problems. Again, folic acid's been added as an enriching item in a lot of food products that don't typically have it, and we have seen a big reduction in spina bifida cases. Malnutrition, one of the biggest things it can cause is low birth weight and prematurity. That's really pretty obvious. Again, you would expect we're not going to have as healthy of an organism if we haven't been properly giving it its nutrients. So again, we see this prematurity. The biggest issue with that is that we have more respiratory and immune problems because we haven't had as much time in utero to really kind of develop those things. Because of the prematurity, we can also see later learning problems, lower IQ scores. There also is some issue then with the nutrition and proper brain development affecting these things as well. Again, we talked about premature birth, and there can also be a higher incidence of adult diabetes, hypertension, and other disease. They think that part of this is linked to the idea that if in utero, the baby is getting the experience that, oh, wait, there's not much food where I'm going. I better make the most of what there is. And that's what they're being told. That's what their body is being told. Where you're going to be living, there's not a lot of nutritional resources. And so the body prepares itself for that. And so when they are born, they are more likely to they're metabolizing food in a different way is the understanding what we think is going on. And so we have a higher incidence of adult diabetes, hypertension, and other disease because their bodies have been set up and predisposed to kind of say, you're in an environment that doesn't have much nutrition. When they get out, that sometimes isn't the case. So if you were in a prenatal environment that said there's not a lot of nutrition, and then you're born in the United States and you eat, lots of the things that we eat in the United States, like fried foods and those sorts of things, your body has been predisposed to make the most of what it gets. And when it's getting a lot of high-fat foods, it's making the most of those high-fat foods, which means we do put on more fat, which is one of the biggest things that causes this adult diabetes and hypertension and obesity in general. So again, we see this as the experience of prenatal development. And we'll see that mirrored over and over again through development, how experience is really shaping what we're being prepared for. So remember that kind of idea. Again, there's sensitive periods for malnutrition, just like there are sensitive periods for teratogens, just like they are sensitive periods for all kinds of different areas of development. In the first trimester, because so much is going on in that period of the embryo, we have really bad physical defects, or we can just have miscarriages and the organism not be viable. And we saw this a lot in the famine in the Netherlands in World War II. Again, the Nazis shut off the food lines to the Netherlands, and so they starved. And we saw a lot of these kinds of effects of starvation on pregnant mothers and their developing organisms. In the third trimester, because so much is going on with brain growth, that's the biggest kind of correlate we see, is a smaller head and brain size, because so much of the third trimester is about brain development. Prevention, again, folic acid, hugely, crazily important. Not only does it help with neural tubes, it actually prevents premature birth. So again, folic acid daily is really important throughout the pregnancy, not just at the beginning. Calcium is known to prevent maternal high blood pressure, premature birth. Again, these things are included usually in a prenatal vitamin, but really should be included in the diet as well, foods that are rich in these things as well. Magnesium and zinc reduce prenatal and birth complications. Iodine prevents mental retardation and stunted growth. And vitamin C early in the pregnancy is really important for placental growth and birth weight. Vitamin C is also actually very important for sperm development. So it's something that men really get benefits from taking that prior to conception for really healthy sperm. So again, nutrition is going to affect both the mother and the father just at different points in prenatal development, kind of prior to conception versus after conception. Prenatal care is, again, really important. Prenatal care, individuals receive information on diet, exercise. They have opportunities for various kinds of prenatal testing that can help make the developing organism healthier. We can also see kind of notice if something's awry and account for that. And again, that can provide really good resources on what substances should be avoided and what substances shouldn't. Lunch meat has issues with listeria, and so pregnant women either shouldn't eat lunch meat or need to heat it to a certain temperature to eliminate this because it can be really harmful. Cat litter, harmful. So there's again, I think it's more what's in the cat litter than or what the cat's doing in the litter than the cat litter itself. But again, prenatal care advisors can give you all of that information. It usually involves monthly visits from about 8 to 10 weeks until 28 weeks, and then every 2 to 3 weeks until 36 weeks and then weekly until delivery. So you'll have mothers typically have a monthly appointment. And then they go to about bi-weekly appointments. And then really towards the end, we go to a weekly appointment. And this is, again, monitoring the health of not just the fetus, the developing fetus at this end point, but the mother as well, both health. And we really do see decreases in infant mortality, stillbirths, and maternal mortality when we really have good prenatal care. As you would guess, socioeconomic status and race are huge factors in receiving adequate prenatal care. The race issue usually has more to do with socioeconomic status than it does with any sort of racial things. There are obviously cultural issues that can impact this as well, but really it has to do with the fact that different ethnicities and races tend to have lower socioeconomic statuses, and so then are not receiving this adequate prenatal care. Labor and delivery, we're going to go through this pretty fast. There are definitely things in labor and delivery that can have developmental outcomes, but they're not as much as that prenatal period. So stage 1 includes contractions. The cervix dilates to 10 centimeters. We have a facing where we have the shortening of the space of the fetus, now infant, will need to travel. Stage 2 includes the pushing, and stage 2 ends when the baby is delivered. So most of what we consider labor is really a lot of stage 2 when people think of someone in labor. Stage 3 is the delivery of the placenta and the afterbirth. So again, this is when that will be delivered afterwards. So here's a graph or an image that shows you that. So this is kind of stage 1, where we have the dilation of the cervix, so that, or the neck of the uterus is another way to call it, so that, again, that the baby can get out. Stage 2 in image B has the pushing, where, again, the baby is coming out. And then stage 3, the placenta detaches, and we see delivery of the afterbirth, and the placenta and the umbilical cord. The newborn baby begins life with all kinds of different things. Not only are they affected by their genes and their genotype, but they're also affected by all those prenatal factors that we talked about, any birth complications as well. These prenatal factors and birth complications are really environmental factors. So again, they're already at birth been hugely impacted by both nature and nurture. So again, even at the stage of birth, even at the stage where they're first kind of quote unquote on the stage, we've been hugely impacted by both of these things already. These prenatal factors and complications can affect learning, perception, and cognitive skills, and we'll get into those later. What we used to think was that at birth was kind of a blank slate, and we were only shaped by genetics and biology at that point. And we know that's not true now. We even know some things like homosexuality can be really affected by not only genetic factors, but prenatal factors as well. So again, both of these things are working in tandem to create the organism that is born, and we can't tear one apart from the other because they are so inextricably linked. So shameless plug, here's my newborn baby when she was newborn. I guess that's almost 4 years ago now. So there she is. In assessing the newborn's health, we do it in several ways. The most common way that we do it immediately after birth is the Apgar. The Apgar is assessed at birth, and then 5 minutes later. We do that really to make sure that we're getting because babies can improve. So the first measure may not be very good, but the second measure may be a more accurate representation. But we need to get that first measure to make sure right away kind of how we're doing, and that treatment can really be started if there really is a problem. So again, we do it at both times. It assesses heart rate, skin color, respiration, muscle tone, and response to a mildly painful stimulus. We do all of these things to really just assess the health of the newborn. And a 7 or above really indicates a healthy newborn. Apgar is actually an acronym. It stands for appearance, pulse, grimace, activity, and respiration, which again are all those things that it's assessing. So heart rate is pulse, Skin color is appearance, respiration is respiration, muscle tone is activity, and the painful stimulus is grimace. So again, all of those things are being assessed. Hopefully this video on this next slide is going to play. We'll see.
About to give birth, this mother is well into the second stage of labor, pushing and delivery of the baby.
Come on, lady. There you go. Keep going. Go for it. Come on, bring it up. That's it, lady. Keep going with it.
Contractions have become longer, stronger, and more frequent. This stage of labor, which lasts approximately 1 hour, is shorter than the first stage, which may take from 12 to 14 hours or longer in first pregnancies. After laboring for more than 9 hours, Lee gives birth to a healthy baby boy, Carter.
The appearance of a newborn does not fit most people's definition of cute baby. There are many variations in normal appearance that may include a misshapen head, flat nose, swollen genitals, and acne. Most of these are temporary. Weighing in at 8 pounds and 19 inches long, bow-legged, wrinkled, red, and covered in vernix, Carter represents the typical newborn.
Vernix is that white stuff.
The Apgar is used by healthcare providers to quickly assess a newborn's overall physical condition. Newborns are rated at 1 minute and 5 minutes after delivery on 5 distinct qualities: appearance, pulse, grimace, activity, and respiration. For each category, the minimum score is 0, the maximum score is 2. The baby scores for each of the 5 categories are added together to get the final Apgar score.
There we go. Hi. And with cries will pink up. So we at a minute yet? Alright, so we're at a minute. And he's got some tone here. We'll even hold on.
That's activity.
Alright. Taking a good cry. And we'll check a heartbeat. His lips are starting to get pink. Hi. Yeah, you look good, don't you? Got a good pulse. Crying really well. So at 1 minute he had an Apgar score of 8. His tone was 1 and his color was 1. He was still a little bit blue. Otherwise he had a good reflex, he had a good cry and good breathing, and his heart rate was 160 beats a minute, which is a good heart rate. So I'll give him an Apgar score of 8. And you can see his tone's even getting better, and he's even getting pinker. And he's crying well, and he's got normal breathing. He's making his cries, but he's...
Like Carter, most infants who are in good health score between 7 and 10 on the Apgar. Infants scoring in the 4 to 6 range are considered to be in fair condition, but may need some special care, such as suctioning of the airways. Infants who score between 0 and 3 are typically non-responsive, limp, and pale, and in need of immediate life-saving efforts.
So those really low scores that they can get in the beginning are why we do it at 1 and 5. If we were just to do it at 5, when we're getting a more reliable measure of infant health, we would have missed the first 4 minutes of those life-saving kinds of activities for these really low-scoring infants. So again, they do it both at 1 and 5 for kind of a myriad of reasons, but it really is that we do see most infants improve. You can see there, Carter had an Apgar of 8 for his first minute, and they hadn't taken his 5 minute yet, but the doctor was already saying we're seeing improvements in the things that he had scored lower on. So I would guess that he was probably going to have more of a 10 by the time he got to his 5 minute Apgar rating. Another way that we do assessing the newborn's health is done later, which is the Brazelton Neonatal Behavioral Assessment. And this is typically done 24 to 36 hours later. And we use this to assess the baby's style and temperament based on various reactions to different stimuli. And it includes 4 different categories: attention, social responsiveness, muscle tone, physical movement, control of alertness, and physio response to stress. All of these things can give us indications of issues that might be there in development. So both of these, Apgar and the Brazelton, are used to see if we have kind of these typical kinds of behaviors that we expect out of newborns, these typical kinds of behavioral responses or physio responses that we expect out of newborns. If we don't have that, that may indicate that something is wrong. And again, if we find that something is wrong earlier, we can treat that earlier. Preterm infants typically have problems breathing, which is called anoxia. We also have less mature brain patterns. That's because their brains aren't as mature. If you remember how much brain development is going on in that kind of 7 to 9 month period, it's a huge amount. So if you're born preterm, you're born a month early, 2 months early, your brain really wasn't ready to come out. It's really not ready to take on the stimuli that they're going to be going to be experiencing. So again, we do see these less mature brain powers because their brains are less mature. They just weren't their brain wasn't physically ready to come out. We see more disorganized. Again, this is going to be issues with this brain development, this organization, and we'll talk about this a little bit later. And chapter 5 is really evidence of kind of proper brain development. And so we'll see this infant being a little bit more disorganized because, again, we really just weren't ready to come out. We see a difficulty to soothe. Again, this is going to a lot of times have issues with the stimulus that you're experiencing as a preterm infant is not something that you're really ready to experience. You're supposed to be experiencing sounds, yes, but muted sounds because you're inside. It's supposed to be dark. It's supposed to be warm. And if you think about where preterm babies are, a lot of times they're in NICUs. NICUs are not dim. They are bright, if anything. They can be loud. There's a lot of machinery. And so they're getting a lot more stimulus than they're capable of really handling. And that's going to make an infant harder to soothe. There's also at risk for physical health, behavioral and cognitive problems. Another thing that we'll see typically a lot of deficits in our lung development and immune function. Those are other things that are really kind of finishing off in that last time period. So because we don't have as developed of an immune system and we don't have as developed of a respiratory system, it's going to be harder to kind of to do those kinds of things. And again, these behavioral and cognitive problems are going to be issues of my brain wasn't ready to come out yet. Preterm babies are different than small for gestational age babies. Small for gestational age babies may be born full term. They may technically be, and full term is 37 weeks or above. They may technically be 37, 38, 39 weeks, but they look like a preterm baby. And they may require additional care in the NICU, things like that, because again, they're responding, they're acting, and they seem to be more younger, and they're smaller and underdeveloped compared to what they should be for their gestational age. They don't arouse easily. This is going to be kind of issues with some of these the same kinds of issues that we see with preterm infants. Poor muscle tone, poor recognition, memory. Again, all of these things make them look like preterm infants when they really are not preterm infants. They really are full-term infants. And so these children may also need additional care in the NICU. The NICU is a neonatal intensive care unit, for those of you not familiar with that. The infant-parent relationship is really important in development. It's really important early in development. And it does become a little bit more difficult in the NICU. There's lots of stuff that's been done and lots of research about that. We see kids that get infant massage and are getting a lot more skin time, skin-to-skin contact in the NICU actually can leave the NICU quicker. Things like Tiffany Field's work on kangaroo care has some really interesting research on that and on NICU stays. And all those things will obviously really help with the parent relationship as well. There's also issues with the prematurity stereotype, what other people think, what the parent themselves thinks, and that will affect the relationship. NICU stays are expensive, and so these financial resources can stress the parent out from this NICU stay. I mean, it's a stressful period. Your kid's in the NICU. You've had this baby. They're in the NICU. It's very, very stressful to begin with. And then you add a financial strain on top of that, and it can be even more problematic. Some NICUs, again, aren't allowing as much touch as they really should be allowing, and the same thing with stimulation, and this can really not be good for the parent-infant relationship, and it's really not good for the development of the infant too. Again, Tiffany Fields has some really interesting work on this, in things about infant massage and kangaroo care for preterm infants that we really see really good outcomes for. This is just to remind you that, again, that you should have watched that Nova's video, Life's Greatest Miracle. It really has great, great images on prenatal development, and it can explain prenatal development in a visual way that lecture is just physically not capable of doing. So I really encourage you to watch that. It really will help with your understanding of the material, which translates to helping your understanding on the test. So I hope that our partial online lecture went okay. If you have any questions about this material, please do not hesitate to email me, ask me before or after class, come to my office hours. Any of that is definitely really, really encouraged. I know that we are not an online class, so we don't necessarily have those communication channels set up. So please, please let me know if you have any questions about any of the material covered in Chapter 4. Well, any material covered, period, but especially in Chapter 4. Thanks.